Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, we're super excited to have you here because we're having some amazing conversations with leaders that are painstakingly shaping the future of healthcare. And we happen to be really crazy about a few different things. We're crazy about healthcare innovation, leadership, adoption of innovation. And if it's your first time tuning in, let me just sort of take a quick step back to tell you what exactly it is that we're doing here. So we're focused on bringing real stories of innovation to life. The aim is highlighting real people that are in the trenches, getting stuff done, and giving them the opportunity to share their stories, their successes, and some of their setbacks, with our community and ultimately with the world. We've got an amazing action-packed year of incredible conversations that are teed up. But if you haven't already, make sure that you hit the subscribe button now wherever you are so that any new interviews come directly into your inbox. And as you know, our field, it's always evolving. And it's crucial to have leaders that are actually envisioning the future and are eagerly embracing innovation to address many of these pressing challenges. And there's no shortages of challenges, which means that there's a lot of opportunity to innovate. So our next guest on the show is actually one of these leaders. So today I'm thrilled to have a conversation with Dr. Anthony Wehbe. Dr. Wehbe is a board certified internal medicine physician and a healthcare executive whose career really reflects an unwavering commitment to improving the delivery of care through innovation, leadership, and compassion. So over the years, Dr. Wehbe has held numerous influential roles, a senior vice president and physician executive at Jefferson Health. Dr. Wehbe's passion for delivering care beyond the walls of a hospital inspired him to found Sena Health, where he currently serves as CEO. So Sena Health specializes in home-based clinical services, including hospital at home programs and advanced primary care at home. He remains deeply committed to his clinical roots, maintaining affiliations with medical facilities such as Jefferson Health Stratford, Cherry Hill, and Washington Township. So in today's conversation, we're going to explore Dr. Wehbe's inspiring journey and rethinking just how care really is delivered. So Dr. Wehbe, welcome to the show. It's great to see you.
Michael, thank you so much for having me. I'm super excited to be on the show here with you today. I know we're very much aligned in our passion and commitment to
Yeah.
truly transform the way people experience healthcare. So I'm humbled and honored to be here, Michael, and I look forward to the conversation. Thank you again.
Yeah, of course, of course. So before we kind of step into some of the serious stuff, I always like to ask, what's one thing about you that might surprise your patients or your colleagues?
Wow. One thing about me that I don't know if this will surprise people or not, but I am a workaholic. I'm very passionate about what I do, and yet I try to balance everything in my life between my children, my family, and work. I always try to be very present when I'm with my patients and with my colleagues and partners that I work with. So people always say, "Wow, you always handle so much and you do a lot." So maybe that's one thing that'll surprise people. I don't know if I answer your question.
So listen, your path to medicine, began at Philadelphia College of Osteopathic Medicine and took shape through your residency at Rowan University. I'm just sort of curious, what sparked your initial, passion for healthcare, and did you always know that you'd want to combine it with leadership?
So I did not. When I was an undergrad, I went to St. Joseph's University here in the Philadelphia area, and I was dual a major in pre-med biology as well as business, which was very unique and different at that time. You're talking in the late 90s. So everyone in my family has always been in business and construction. So no really, healthcare and advanced degrees that way. But I've always enjoyed the sciences. And when I was an undergrad, I volunteered at local hospitals, uh,
Hmm.
being Lankenau Hospital, where actually all four of my children were born, eventually years and years
Yeah.
later. But I was there volunteering as an undergrad college student. And I just loved medicine. I just felt it was more of a calling for me.
Hmm.
Um, I actually started my first business in marketing when I was an undergrad. This was in the late 90s, where today you can start a business on your phone. It was very much different back then.
Yeah.
But I felt, even though I had my own business at a very early age, I just felt that medicine kept calling me and calling me. And I didn't want to have any regrets. So I applied to medical school, was interviewed, and then thank God got accepted, sold my business, and kind of the rest is history.
Wow. Wow. So in that time as you stepped into the business side of healthcare, I know that you'd done some postgraduate work. How has that shaped your approach, as a clinician and an executive?
So my training in residency was in internal medicine with a focus in primary care. Um, when I look at healthcare, I've always been attracted to vulnerable populations, helping vulnerable populations, especially elderly populations. One of my earliest memories was going door to door in South Philadelphia, an old Italian neighborhood there with Dr. Anthony Leone, one of my mentors in medical school. And the response he got from people walking into their kitchens, taking care of them at home, that truly influenced me as a physician early on. I was a third year medical student. And don't get me wrong, the food was good. I mean, we had an Italian spreading of lunch, like 5 lunches every single
Yeah.
day, rounding on patients. But that really influenced me in terms of caring for vulnerable populations. So when I went through internship and residency, I had a focus in primary care. And then when I started practicing as an internist, I still had that entrepreneurial bug. I wanted to truly make a difference, truly set my course. So I started practicing as a hospitalist. And as a
Nice.
hospitalist, you're picking up shift work, you're doing 10, 12, 14 shifts a month in the hospital. So you have half the month essentially to do other things. And for those that know me, they know I can't just sit still. So I started multiple companies and that's how I got involved in healthcare administration. I'm one of those people, if I see something wrong, I raise my hand, voice my opinion. And we all know in healthcare, especially in hospitals,
Right.
unfortunately, a lot of inefficiencies. So next thing I know, I'm sitting on medical committees. I was made a medical director, unbeknownst to me. So I just got put in these leadership roles, and I just
Right.
felt that I was able to make a difference in these leadership roles. I had no intention of getting into corporate healthcare and becoming a physician executive, but that was the path that was laid out for me. And I kept getting different, leadership roles, assistant vice president, senior vice president, and was very fortunate to have a strong team around me and some great people that I worked with over the years. And that's what got me into healthcare leadership. And then I decided, about 5 years ago, that I wanted to go out on my own and see what I can do on my own with a team. And that's how I started Sena Health to solve for the problem of access in healthcare. So it's been a long journey for me.
Yeah. Well, it just sounds like two things. Number one, it sounds like relationships are really important to you, and that when you're in certain moments, you maximize those times, as you mentioned earlier about being present. And it also sounds like, you've had the opportunity to wear many hats: physician, executive, entrepreneur, innovator. Um, how do you prioritize your time and energy across such diverse responsibilities?
Um, it's not easy. It's not easy to prioritize your time because I'm one of those people that just I want to get a lot done. Get stuff done is one of my mantras, and my team can tell you that for many, many years. And there's a lot to be done in healthcare, So I constantly reflect on a daily basis in terms of what are my priorities, what can I accomplish, and how can I move things forward. So it's a constant battle, Michael, in terms of what to prioritize because there's a lot to be done and a lot that needs to be done. So it's not an easy task, something I continue to work on and try to find new techniques to do that. And I have people around me that support me in what I do. This is not a one-person show for sure. I have people that are much smarter than me that I work with. That I can lean on a daily basis to help kind of ground me. So that's
Mm,
how I approach it.
mm. You know, you mentioned around your rounding with Dr. Leone and doing house call visits and that having a profound impact on you. And then you kind of went to, I'll call it a tour of duty on different tours and you picked up skills. Was there like an aha moment where you said, I need to kind of create this new entity, or was there a straw that broke the camel's back? And if so, what was it, and how did you get it off the ground in terms of Sena Health?
So there wasn't one specific moment, Michael. I think throughout my career, I always try to push the status quo. I always try, to me, if you're not constantly thinking of how to do things differently, you're not progressing, and you're not moving things forward. And unfortunately, in healthcare, it takes many, many years for things to even become standard of care. From the moment a new medication is discovered or a new procedure, um, for it to become standard. And there's many reasons around that, right? You don't want to be one of the initial people taking a new medications or a new procedure. So it's hard to innovate in healthcare, period. However, you
Right.
need to constantly be pushing that in order to truly progress and move forward. I worked at a very innovative health system, Jefferson Health, under the leadership of Dr. Klasko, who got national and international accolades for, we had a whole innovation team and an innovation center. And even despite that, it just becomes challenging, right? We worked with a lot of startups, even when I was at Jefferson, and a lot of the pilots would go through my division. I was in charge of several hundred physicians, and I would push the team to innovate. I was begging and pleading for telemedicine as an example, and incentivizing our doctors to do telemedicine for years, Michael. All we needed was a pandemic to get that momentum going for telemed.
Perfect storm.
Yeah,
Perfect
exactly.
storm.
Um, but there wasn't that one moment. It's just a mantra of mine to progress in life and continue to find new ways to do things. I mean, my children will tell you that focus and progress is an important kind of core value that I have personally. Um,
Mm.
and I find it's hard a lot of times to innovate within the system, right? A large health system, there's a reason they run the way that they do. There's a reason there's a lot of uh, processes, let's call them, and policies in place that
That's right.
unfortunately at times can inhibit innovation. So I figure, you know what, I tried for a decade to do that within the system. And I'm very proud of the work that we accomplished. I've launched 27 service lines in my career, try to innovate and incorporate technology into different things that we've done within the health system.
That's right.
So I get to the point, and I said, you know what? Let me go outside the system and try to innovate through partnerships and find like-minded people, whether it's medical groups, health systems, or even investors that believe the same thing in terms of innovation in healthcare. And that's what I'm in that current chapter in my career right now.
Right on. So, hospital at home programs they're gaining traction. And, what challenges did you face bringing this model to life? And what benefits have you seen for both, patients and providers?
Um, so as a company, we started out, gosh, almost 5 years ago, really in the beginning of the pandemic, April of 2020, um, starting with hospital at home. So if you go back to April of 2020, especially here in the Northeast area of the country, New York, New Jersey, Pennsylvania, we were telling people stay away from the ER, stay away from the hospitals unless you're really sick. We were putting tents in ER parking lots, building makeshift hospitals, anticipating the surge in volumes. So in a way, that one of the silver linings that came out of the pandemic was this push to move more care to people, right? Whether it's in their own homes, their apartments, their houses, their nursing homes, their assisted living, independent living, or even telemedicine, right? The whole point was to move care outside of these facilities because we were anticipating to be overwhelmed by the pandemic. So I think that's one of the silver linings that came out of the pandemic. And when you look at this model of care, Michael, globally, not just in our
Right.
country, there's a lot of studies showing the benefit of moving more care into the home. And throughout the pandemic, there's been numerous studies out already, whether in JAMA, whether through Mass General. There's a lot of studies showing the efficacy of, I call it healing at home, right? So it's beyond just acute care at home. It can be post-op care at home. It can be advanced primary care at home. It can be observation at home, or even
Right.
sleep at home that one of our clients is doing, where instead of them going to a skilled nursing facility post-hospitalization, they can get those same services in the home. So there's a lot of studies right now showing the benefits of this type of service in the home, essentially putting these devices, this technology in people's homes, monitoring them remotely, and then delivering the services through coordinated care in the home. So whether it's clinical outcomes, such as reduced hospital-acquired infections, improved activities of daily living, and even mortality, Michael. Mortality. Can you imagine at 6 months, if I tell you the odds of you living are better by being in the home than being in a facility? So there's tons of studies showing that. And then also patient satisfaction, people want to be in the home, especially aging populations. There's a big
Right.
push towards people that want to age in place. I have aging parents myself, so I've done everything to, thank God, keep them at home and monitor them at home. So I think one of the biggest challenges that we have in this model of care, just like, you talked about initially, innovating in healthcare, I think it's a change management component, especially when you try to change the care delivery model, right? Because
Mm,
doctors, nurses, case managers, social workers, everyone that's involved in running a hospital,
right.
they're not trained in hospital at home, right? So convincing them, educating them, showing them the outcomes, it's taking time, but we'll get there, right?
Yeah.
As it's not a matter of if this is going to happen, it's a matter of when, for multiple reasons, right? So you have better clinical outcomes. As a country, the cost of healthcare keeps going up and it's unsustainable. So there are very few things in healthcare that can reduce the cost of care, and this is one of them, where it's meeting patients at home, getting them out of the hospital. And there's already a big push to get people out of the hospital. Right? As a hospitalist myself for years, we're always looking at length of stay, readmission rates,
Right.
all these metrics that even hospitals get penalized for by CMS and all the payers, right? So there's been already that push. So now, I think all these patients can be cared for at home with a higher quality, lower cost, and a better patient experience, right? The triple and quadruple aim that we all
That's
talk
right.
about.
That's right.
But the challenge is the change management, in all honesty, number one. Number two, it's the payer reimbursement models catching up with it. So there are
Yeah.
pockets around the country, even Medicare passed, the hospital at home waiver where they're paying hospitals to do this. There are state laws, such as in New Jersey, where actually New Jersey now mandates parity in commercial payers. So if a hospital has a hospital at home program, Medicare approves it, they are mandating every other commercial payer, whether it's Medicaid, MA plans, to pay for hospital at home. So I think those two challenges, which I think eventually will
So,
catch up,
so it
are there.
sounds like what you're saying is that there's some market forces and some shifts that are happening that are allowing for the alignment of incentives to occur so
Yes.
that business models can really catch and start to take off and become regular occurrences. So let's just say that that's happening regularly, spanning across the country, and now you've managed to sort of scale Sena Health and Sena Care, while maintaining this patient-centered approach, because that seems like that's probably the number one core thing. What's what's been your biggest learning experience in balancing growth, as a business, and with quality care?
So to me, quality care should always take a priority, and one of my mentors, Dr. Condalucci, he's a pillar in the community here in the Philadelphia area from the Daisy Battle HIV, is one of the pioneers nationally, internationally. He always would tell me, Anthony, if you do what's right for the patient, everything else will work out. And I've always taken that to heart in my decision making. And sometimes it doesn't work, because you also have to balance the economics of running a business and running,
Right.
healthcare organizations. It's funny, the nuns at one of the hospitals taught me no margin, no mission, right? That's the other thing.
Yeah.
You have to have a margin in order to have a mission. So I try to balance those two approaches. But to me, quality has to take precedence. And people assume that they'll get high quality care when they go. Unfortunately, it's not always the case. That's driving a lot of decision making in healthcare. But to me, I've always taken that mantra, and will continue to do so. That if you do what's right for the patient,
Mm.
finances and everything else will work out. And that's always been my approach, and will continue to be the approach, Michael. So kind of balancing the two,
Yeah.
is
I'm
how I approach things.
I'm just sort of thinking in my mind, because many healthcare systems they still really lean heavily on traditional hospital care models. And I mean, how do you advocate for home-based solutions, in a field and in a time, especially at the time of our conversation, it's so rooted in institutional models.
I lived that for many years, right? The very first email that pops up are volumes, surgeries, inpatient heads and beds, but it's the system, Michael. I am not pointing the finger or blaming anyone. It's how
Hmm.
the system is incentivized. We have this addiction to fee for service. So the way you incentivize a system is the way the system will go, right? We've all been talking about population health and value-based care. And, I used to work closely with
Yeah.
Dr. David Nash, who is the founding dean of the Jefferson, the first college of
Hmm.
population health in the country. And that was one of my titles over the years, was chief population health executive, right? So I try to look at value-based care and approach it from a population-based perspective. But unfortunately, the majority of the reimbursement in our country is still driven by fee for service. Let's call it what it is. So
Yeah.
until the reimbursement models change, that's how unfortunately the system will keep pushing for the operations of healthcare. Now, I do think there are market forces in a fee-for-service model that will influence home-based care. For
Hmm.
example, with the cost of living going up, the cost of building one hospital bed is significant. And many hospitals around the country just don't have the finances to add new beds and build new
That's
towers,
right.
right? A lot of our hospitals are struggling to meet the financial needs and demands. So one of the benefits of home-based care is you don't have to build a new bed. They live in their home, you can lease this equipment that's becoming very affordable. The most expensive part is getting a nurse out to the home, or getting that person, the pharmacy, the medication, which is still cheaper than a hospital bed. So I think that's going to be one of the market forces as well. And then also, when you look at historically, Michael, when you look at healthcare and the history of healthcare, let's take, for example, ambulatory surgical centers, right?
Right.
Historically, there were always these surgeries that were required to be done on an inpatient basis. So there was an inpatient list where all these, whether orthopedic, cardiac surgeries,
Yeah.
needed to be done on an inpatient. Now, the majority of the surgeries in our country is done on these ambulatory surgical centers. It's better outcomes, lower cost, and a better patient experience than to go in the inpatient end. So I truly believe, because I'm seeing this in pockets with some of our
Right.
clients, whether in New York and Florida, that these payers are going to say, well, look, you can treat that pneumonia or congestive heart failure in the home on a much lower cost basis than to do it on an inpatient end. So they're going to start denying a lot of these inpatient admissions, and then once you start denying those inpatient, and I know many of my hospital clients actually, they face that they're getting a lot of denials as it is right now. So I think the market will push that. And when you look at companies like Milliman, right, MCG,
Hmm.
Interqual have guidelines for hospital at home. So there's enough studies out there showing that, hey, this patient that's here for UTI or congestive heart failure meets criteria for hospital at home and can be admitted. So I think the market will transition towards that eventually. And I think it's in the best interest of the hospitals because they're not going to be able to serve a growing aging population, right? So in our
Right.
country, as people age, there's going to be a demand for more inpatient beds, and we can't afford to build those beds, right? So
So
that
that story that you're telling to an executive team, you're saying, look, if you want to grow, essentially, traditionally, you would secure loan, make this big building. It's a real estate play.
Mhm.
You're saying, look, we can generate revenue without this fixed operational cost, or it won't be as as substantial as it normally would historically. How do they take to that? Do they, as business folks, as clinicians, do they see the model? Do you, and, you're talking about evidence, but what what really moves them? Is it the revenue portion that you can showcase, the modeling that you can do, or is it just they're so used to doing things a specific way, a certain way, and they're like, look, this has been done for 50 years. We build a new building, we fill it, we know we're going to make certain money on it. Like, what's the thinking behind it? Because listen, you've sat in the seat, so I'm just curious as to how your peers are thinking about this. You know, if you're talking to them outside of the normal day to day, and you're around at a dinner table and you're saying, what do you really think about this? How do they respond to that?
So, Michael, that's a great question. And I think the short answer is it depends who I'm talking to. I've talked to, gosh, I'm trying to get the exact number here, but definitely more than 1,000 people, healthcare executives over the last couple of years since I started
Mhm.
Sena. Not one person, Michael, not one person said this is a terrible idea, Anthony. Like like not one person, right? But the next question, once they say this is a great idea, I mean, I'd love it for my mother, my father, my significant other to get care in the home because, and then they just start sharing these terrible hospital experience that they've had, right? It's not easy
Right.
running hospitals. Like that's, I made a living being a hospitalist. I've managed and run hospitalist groups and hospitals. It's not easy to run, and the hospital of the future to me, and this is not just me saying, many experts say the hospital of the future will be trauma, operating rooms, emergency rooms, and telemetry. The general medical floor types are going to go away. Those patients can be treated at home. And by the way, a lot of experts, including, for example, Dr. David Levin from Mass General, who's considered a
Hmm.
world-renowned expert in hospital at home, says it can be anywhere from 40 to 50% of what gets seen in a community hospital can be treated in the home. Let that sink in. Almost half of your, can you imagine almost half of your volumes can be eliminated and be treated in the home? So that scares a lot of people because what they're thinking is, oh my God, I have my budget to meet, I have my board to, present to, I got to create, it's a quarterly, targets that they're meeting. So again, they all say this is a great idea. So the next question I get is, well, what does the economics of this look like? And that's the challenge we're in now, Michael, because yes, Medicare is paying for it once create a program. Some commercial payers are also paying for it, but it's not as ubiquitous, right? So
Mm.
eventually we'll get there. But the way I try to frame it up for these healthcare executives is, to your point, you want to build a brand new tower with 100 beds. It's going to cost you $300 million. You're going to go out and take out a loan. So imagine, instead of building a brand new tower with 300 beds, build a virtual tower with 50 beds that's going to cost you almost a fraction of this brand new tower, right? I mean, I've even given them idea of, how we love naming buildings, brand new.
Hmm.
It's like you can get a donor and philanthropy, especially for these non-for-profits, and you name this virtual hospital that's truly serving the community out there.
That's right.
So I try to frame it in a virtual hospital concept where, yes, that pneumonia patient, UTI patient can be admitted to this virtual hospital, but also your existing patients now, you can cut the length of stay by 1, 2, 3 days, and there's a dollar amount to that. So
That's
even by
right.
getting people out of the hospital earlier, treating them in the home, that would help their current economic condition. And the one thing I'd also add, Michael, is because I feel a lot of times in healthcare, we always say, let's pilot this, right? Let's try it out. Let's dip our toes in it.
Right.
And that's not a commitment to me. And I've made that mistake several times with several partners. If there isn't a commitment, now I just say no. I'm just very blunt and direct. Like if you're not committed, if you don't see this vision where I can show you numerous clinical studies outcomes, numerous financial modelings, patient satisfaction scores, if you're just going to dip your toes in it, like let's not waste each other's time. And whenever you're ready, I would be happy to move things
Yeah.
forward
Yeah.
because you have to commit. Just like, let's say you want to start a cardiac rehab service line, or you want to build a new tower. You're not going to say, let me just pilot it with one floor,
Yeah.
before I decide to build the whole tower. So commitment to scale is also imperative in this model of care.
It's all about alignment. And those happen in the beginning, not in the end. So I mean, I've mentioned this numerous times, but there's really three factors that need to occur in order for things to happen, for innovation to actually occur. Number one, they need to know that there's a problem and they have an awareness of it.
Mhm.
Secondly, there needs to be alignment around incentives, alignment around resources, people, time, energy, effort that's going to make this thing occur. And thirdly, there needs to be relationship equity. They need to know that your team are in fact the ones that are going to execute and deliver the outcome that everyone wants. If you go back to any of your deals that happened, I will bet my house that the ones that did occur, all three of those things were in place. Any of the ones that didn't occur, one or more of those things were not in place. So it's interesting to me when you say, hey, it's you need to commit. There's a difference between being interested and committed. They're two totally different things. So love that we just talked about that. And
Yeah.
to your point around talking about how you deliver care at scale and at quality. Listen, you've been recognized multiple times with top doc awards. What what do you think sort of sets you apart in this patient care? Is that replicatable? Is it teachable? It sounds like it is because it's been passed down from Dr. Leone and some of your other mentors. Clearly, it's made an impact on you. How do you keep the human connection alive when we're in such a sort of a tech-enabled, tech-forward world that we're living in?
I love that question, Mike. I'll answer that in a second. But I just want to double down on your comment on innovation and partnerships and those three key criteria, because I learned that the hard way. So you are very much, if any, hopefully your listeners rewind and listen to that, because I learned that the hard way, especially starting out a new company. You get, I don't want to say desperate, but you're like, the clients that come to you and say, okay, we'll try this out with
Hmm.
you. I think it's imperative to be upfront about it and to find those true partnerships that you're aligned with. Because you're right, I can name you all the failures I've had that missed any one of those three components, but all my successes, thank God, I've had all those three components. So I just want to double down on that comment. You're very much spot on with that. In terms of quality, I think one thing in healthcare is I truly believe it's a calling for me, and I hope a lot of people feel that way. There aren't many careers that you can actually, make a true difference and influence in people's lives, and also make a living and wake up every day and have that true North Star that drives you, right?
Hmm.
It's always been like that in my career, whether working for a non-for-profit or a for-profit in healthcare. And that's what Sena is driven by. We keep our mission very simple. Our three core values are constantly there. Every meeting, we start off every meeting with a patient story, reminding us of why we do what we do. And look, there are some days, I'm not going to lie, that it's like, you got a million things coming your way, a patient complaint, a client complaint, the economics, finance all weigh at you, but you constantly have to remind yourself of that North Star and the purpose of why you started the organization.
You mentioned patient story. Do you have a patient story that's stuck with you? Something that
Oh,
maybe reminded you and the team of why the work is so important?
so one of the first patients we got, and I share this story whenever I do a new pitch and whenever I meet a new client, it's like slide number two. We have Sena intro. This is the agenda, and that's literally I start off with the story of
Yeah.
Florence. And Florence is a 93-year-old patient out of Cherry Hill, New Jersey. She was one of the very first patients referred to us by Dr. John Daly, who's a house call physician. He's been doing house calls for decades here in the
Hmm.
Philadelphia area. So Florence was a 93-year-old with a lot of comorbidities, and she had been in and out. She had been admitted to the hospital with a pneumonia. Then she went to the rehab. And then she got worse in the rehab, back to the hospital. So she did that for 4 months, Michael, literally ping pong, bouncing back and forth. And if
Wow.
you remember, July of 2020, patients and families weren't allowed into the hospital or into the
Right.
rehab. So her four children, one of them being Jeff, um, they couldn't see their mother. She's 93 years old. They're like, we've had enough. We want to bring her home. She lives in her own home. She's got four children. Two of them are nurses. We want to be able to take care of them. So Dr. John Daly called us, and she had a pneumonia. She had congestive heart failure. We treated them at home. We got a 2D echo in the home. We drew labs in the home, got an X-ray in the home, deployed the nurse. I was the doctor. I was the nurse. I was the command center. I was like her. And we kept her out of the hospital, Michael, for 6 months, you know? So even though we went beyond the acute episode, and then eventually, like a 93-year-old, she went on hospice and passed away peacefully at home. And I have handwritten notes from her son, Jeff. Like that's what a 93-year-old should be at home, passing away peacefully, not bouncing back and forth between a hospital and a rehab, you know? And look, this is just a fault of our system, Michael. This is not, I'm not pointing the finger at anyone,
Right,
but
right,
we
right, right.
have to be accountable and be truly driven by our patients, right? By our patients and the outcomes. That has to drive us. And once you do that, I truly believe the economics will follow, you know. And I'm not saying you ignore the finances and economics around healthcare because you have to, you know. But that's yeah, I love sharing Florence's story all the time. She's in my slide deck every single time. There's a photo of her there with a handwritten note. But yeah, again, you have to have those stories as a company to drive the mission
That's
every
right.
day.
Yeah, it makes it more concrete, makes it more real. All right, we're getting towards the end here, and I want to cover a couple more things that I think I want to drive this concept of, you said healing at home, which I love, by the way. So I want to play a little game here. It's called Myth versus Reality. And basically, I'm going to share a statement, and I want you to confirm whether it's a myth or a reality, and sort of briefly explain why, if it is a myth, what you think of it. So, home care is less safe than hospital care. So, I mean, myth or
Def
reality?
Definitely a myth. And this is not just Anthony Wehbe speaking, because I get that. I know I'm very passionate. I can get excited about this. So what I do is Chris, who does our business development side, he has these studies like on auto, like he's there's been numerous studies about high acuity care in the home versus a traditional brick and mortar, right? We don't talk about some of the leading cause of deaths in our country, right? Hospital acquired infections, complications. Um, so there's numerous studies around that. This is not just Anthony Wehbe speaking, but that's definitely a myth because care at home and healing at home is actually very, very safe.
All right. What about people don't trust healthcare provided outside of traditional hospital settings?
Um, so I think the pandemic has really changed the way people look at healthcare and trust healthcare. People are more comfortable with technology, telemedicine. I mean, even my, elderly mother now is comfortable checking in with her endocrinologist on the phone, right? On
Right.
that on a telemedicine visit. So I think that trust level has increased. And sorry, one of the questions you asked me earlier was about, AI and technology and how do you keep the humanistic approach and humanism in healthcare. That's very much big on our approach. We are a technology services company, so we're technology first. We are investing heavily in AI. There's a lot of AI functions that our coordinators do, and even when you call our command centers, people interact with virtual
Right.
AI agents. One of the advantages we have, Michael, is we have 5 years of data of how we interact with people at home. So
Right.
constantly keeping that top of mind. And Kathy Lyons, she's always, I have her role as always focusing on our culture and putting our patients first. She'll always jump in there to make sure that there's that humanistic approach in our technology, which has to be top of mind always. So sorry for that long-winded answer.
No, no, that's good. That's good. And then a couple quick rapid fire questions, and then we'll kind of close things up. So what's one book that's influenced your thinking the most?
Oof. Um, with my busy life, I'll be honest, I don't have a lot of time to read recently, but one of the last books I read was Malcolm Gladwell's the follow-up to Tipping Point. So he was down in the Philadelphia area, and I have it on audiobook now, so I've been
All right.
listening rather than reading. But I'm a big fan of Malcolm
Was that
Gladwell.
the
And
David and Goliath one?
yes, yeah.
Yeah, it's a good one. It's a
So
good one.
he's I think his approach to creating that viral momentum, right, in culture and society. He gives tons of great examples. So I would say that's the most recent book top of mind that I've read. Again, because I'm trying to create that momentum, that tipping point in getting
Yes.
more care in the home. So all my
Yeah.
reading energy is focused on on
And
on the
and then what's one piece of tech that you can't live without?
man, and I hate to say it, but it's my phone. It's my phone. I know I just got my 11-year-old, soon to be 12, next month, God willing. He's the last one in his class to get a phone. And, I try to model behavior here, but I'm telling you, I have, unfortunately, with the world we live in now, and,
Yeah.
I'm going from a telemedicine visit with a patient to running a virtual meeting with my team members in like 3 countries. So my phone
Yeah.
is definitely something I can't live without.
And then just sort of last question. So looking back at the journey so far, what are you most proud of? And what's next for Sena Health and how can people sort of follow your work continuously?
No, I appreciate that, Michael. As we're getting here towards the new year, I always try to take some time to reflect, right? And I think a lot of times, especially for people like me who are just constantly on the go, getting stuff done and working, you don't take that time to just pause, reflect, and look at the accomplishments. And I try to do that with my team at the end of the year. When you look at it, we have thousands and thousands of people that we've cared for in the home that otherwise would have been in a facility or wouldn't have had our help and support. So I think that's one thing, I'm really proud of is the people we've influenced on a daily basis that otherwise wouldn't have had the support um, um, in their healthcare experience. So I think that's one thing I'm proud about. And for Sena, we started out as a hospital at home company or healing at home company. We've really expanded those learnings and specifically this clinical command center that has helped facilitate hospital at home. And we've moved beyond that, right, into really focusing on access to care for patients, eliminating the frustrations and friction that people experience when they experience healthcare. So, I tell my team, like, we have to be relentless in eliminating friction, right? And frustration. Like,
Yes.
that's our purpose, right? So, whether it's delivering hospital at home, like getting an x-ray done in the home or a lab tech to go in the home, or coordinating a primary care visit or a GI visit for someone that just had a recent mass identified on an image, like we want to eliminate that friction. So that focus on access 24/7. Again, it's not healthcare doesn't happen Monday to Friday, 9 to 5, right? You don't just
Yeah,
get
right, right.
so it has to be 24/7. And that comes from like I'm a hospitalist by training. Hospitals don't close, don't shut down. So taking that approach, making it 24/7, leveraging technology so it can be affordable, right? Because you have to manage the cost. So moving forward, our focus at Sena is really about eliminating that friction, that frustration in healthcare by facilitating access. Like the big focus for us is helping people access care. And that's what I look forward to the journey to come in the new year.
Amazing, Anthony. It's been really fun chatting with you, jamming out with you. So for those that have tuned in, if you found this conversation particularly enlightening and there were quite a few golden nuggets that came from this, would you mind sharing it on your social media, just engaging with it, commenting what stood out for you? And Anthony, I'm looking forward to our next conversation. Obviously, you're always welcome to come back and share more learnings. And good to see you again.
Good to see you, Michael. I appreciate the time. Thank you so much. Thank you.